Alrighty, I have Bill in the chair today, and as you can see, and I'll show up the before and afters, Bill's got quite a few of the DPN, and I'm going to go ahead and give him a little touch here. He's had these treated before at the derm's office with a hyfricator. I'm just going to give you a little touch here, Bill, and see what you think. Okay, on a scale of 1 to 10, 10 being the worst, how's that for you?
0.
Okay.
Well, that's didn't feel it.
Okay. Well, the small ones up here in the forehead don't tend to, hurt too much. And I'm going to try to be as methodical and quick as possible. You can see that they only need a couple little touches. Still good?
Mm-hmm.
Okay. And Bill knows that when these are treated, he'll appear younger because he'll have less brown in his skin and not get to the point of, say, Morgan Freeman, because all of these will be treated while they're small. And probably about once a year would be a good time to get another treatment, just to clear out the new ones that would be forming. So it's a very, very light touch, but although it doesn't feel super light, right, Bill? You can be honest.
Okay, maybe you're up to a 1.
Oh, well, I like that. Okay. That's super.
I can think of worse things.
Right, I know. Okay, so right here, we have a nice large clogged pore, no current. I'm just stretching this pore. And out comes that nice clogged pore. Now what I'm going to do, I'm going to try to close this pore up. I'm sure this happens from time to time that he gets this clogged. So what I'm going to do is go into the pore. There's no current, Bill, so you won't feel it. I'm at the base of it. I'm going to turn it on and kind of come out with the current on. And that hopefully starts to seal it, but that's pretty large clogged pore. It may definitely go back to filling up with some sebum, but we'll keep an eye on it. Turn it a little bit. It's a little bit of a larger one. I had the current on for the clogged pore, so I had to switch it back for this. If you're using the Skin Classic, it would be set on 30. I would say between 30 and 40, but I'm doing at the base level 30 because these are responding very nicely. No reason to jack up the energy. So we're almost on the forehead. And the witch hazel that we're applying just needs to be a light coat of it. Doesn't need to be super wet. So I'm just going to take your head and just, turn you that way. That's better. Great. And we're working in the eyebrow, and you will not hear the hair singe or smell it burn, because this is electrodesiccation versus cautery. Okay, so I want to be methodical. I'm going to come in from this way, a little less sensitive here, more as we go in. Bill, you're doing great. You're going to look about 20 years old. You're going to squeak more money out of people than you ever dreamed of.
No, we're talking.
He's a fundraiser. These two. You're doing great, really, because I know it's a little
Well,
bothersome.
it's not, You don't see any jerking.
Right, right. And stretching the skin does help quite a bit. Okay, so I want to do right here. And so when I do above the eye, I tend to pull it up pretty good. Still stretch it. And here, I know he will kind of twitch a little bit, but I really try to hold it nice and taut. Great. You're doing fabulous. So again, I want to be as methodical as possible. So I try not to miss anything or even over-treat anything. And especially for a man, right? He's awesome because he's not twitching too much. Although I don't expect everyone to be as good as Bill, but for the most part, our women tend to sit still because they've had so many other things done, maybe permanent makeup, fillers, Botox. But our men sometimes have not really had much of anything done, so it could be a first-time offense, and they may not care for it. Okay, just want to see my progress here. Okay, good. Just going to turn your head a little bit this way. Try to clear these all out here, give them more of a homogeneous look. Turn you a little bit more this way. And he knows that these are going to get a little crusty looking, so they're not super dark on his skin. But tomorrow, the next day, or within 5 days, they'll be a little darker, but no one may even notice that he had anything done except somebody close to him. Oh, Bill, you're crying. It's okay.
I'm a crybaby.
And I'm all out of lollipops. You see these dead cells just kind of blossom up. Perhaps when you wear your glasses, you just might want to be careful right in that area. I'm going to turn you this way. I'm going to turn you all the way this way. Perfect.